Hi, I'm Dr. Michael Miyazaki, and we are recording this, well, I'm recording this on September 1st, 2025. So today is a holiday. It's the no Labor Day. So it got me thinking today. We've been doing a lot of clinical videos last couple weeks, so I wanted to kind of step back from the clinical and just touch base with everybody that checks in with us on these YouTubes. And I wanted to discuss setting up for success in 2025, at least what's remaining of it, the last 4 months, and setting ourselves up for success in 2026. And I was kind of inspired to speak about this because I don't know if you all have seen this report, but it was from the HPI, the ADA. So the Health Policy Institute issued or released a report this month, and it was just interesting. It said some of the things that we're kind of obviously aware of, that there's more women entering the profession, which I think is great. There's more dentists coming to the profession, which I think is good. But some of the things that we've also talked about during these programs that we now know is that expenses are rising and revenue has gone down slightly. So we're working harder and we're making less. And so the next, this part, and I've talked about it, if your expenses are going up and your revenues or what you're bringing in is going down, and those two lines get closer and closer, that just means our profitability is going down. And so why is that? Well, many of us are on insurance plans, and insurance plans are not raising the rates of reimbursement. They're actually decreasing the rates of reimbursement. So that makes it much harder. And then we've had inflation with our supplies, we've had inflation with our wages, and so it just makes it very difficult to drive towards profitability. And so if you're a practice owner, which I am too, I understand the frustration that sometimes you have. You're working hard, you're trying to take care of your employees, you're trying to take care of your patients, but then you're also trying to take care of your family, and it can be difficult. So the HPI called this the financial squeeze, and we've been talking about this during many of these programs, that dentistry now is changing and you really have to run it like a business. It said that the incomes since 2010 are actually going down for adjusting for inflation. And so what we see is that dentists are actually working a little bit more hours, and some of those hours are non-clinical hours. And even as I travel around and I'm teaching dentists, I run a dentist now who are working 6 to 7 days a week. And I tell them, to me it's kind of crazy because you've got to take care of your family and your health. But that's kind of what we've been kind of pushed to do. The good news I got out of this report was that the dentists that come out of school typically will join a DSO as they get started, but that most of the dentists' their ultimate goal still is to have their own practice. And so ownership just seems to be a little bit more delayed. The dental students are graduating, they have more debt, so it takes them a little bit longer to get to the point where they can purchase a practice. But that still appears to kind of be the end goal for many of the dentists, which I think is great. So let me just kind of discuss some of the points that we've discussed in some of the other YouTube programs. And I don't know if you know, but we have podcasts available from the Vista Apex Solutions website. And some of these podcasts are great. We just did one last month with Dr. Bill Blatchford, and we have another one coming up this month, and we haven't put it out yet, but it's with Carrie Strain. And there's some great both practice management insights and business insights. But some of the things that we've talked about during these YouTubes are that dentists are in a dental business, doing the business of dentistry. So we really have to run our practices like a business today. Before when I started dentistry, there were a little bit, there was more profitability. And so we didn't have to watch all the numbers as closely. You would work, and at the end of every month, you were going to typically have more money than you had when you started the month, so which was a good thing. Today, it can, like we saw in those numbers, it can be difficult. And so you need to look at the numbers, and if you need help looking at the numbers, find that help. And we've talked about this in other podcasts and our other YouTubes. but dentistry really is a business, and you have to take care of it like a business. On these YouTube programs, the tips I'm trying to share, yes, they're very much centered around Vista Apex Solutions products, not entirely. I talk about other things also. But what I try to do is I try to share tips and ideas to help you go to your practice and do many of the clinical procedures easier and I hope more successfully. We've covered everything from bonding to endo to occlusion to aesthetics and just everything that it takes to be a successful dentist today. My mission is to help my colleagues in dentistry, and that's everybody: dentists, hygienists, front desk assistants, and I should put it in here, even lab technicians. So we all work together. And just in this last month, I was in Detroit teaching endodontics. I met up with Dr. Ryan Walsh, who was in our last two, in the last two of the 3 YouTube programs that we did, and we had a chance to meet up with our R&D team in Racine, Wisconsin. I flew over to Korea and worked on some diagnostic equipment with a company called IOBio, and I did a couple programs about their diagnostic equipment in these YouTubes and we were working with Yonsei Dental School in Korea. A couple weeks ago, I taught a live patient treatment program on comprehensive dentistry restored aesthetically with the Pacific Aesthetic Continuum. I'm working on a chapter right now on a book on occlusion, and then I made time this month to film an online education course that we will probably be launching next year in 2026. And that focus is going to be on quadrant dentistry. So instead of just doing tooth by tooth dentistry, we're going to talk about doing quadrant dentistry. Not only is it better for you, but it's better for the patients, I think, because you can get more done and you have more control over that quadrant as long as you know how to put all the pieces back together. So all this shows is that what I'm trying to do is I have my private practice, work Tuesday through Friday, and then do all these other programs on the side, maybe to be a little inspirational, because I really think that dentistry is a great profession. It allows us to do a lot of things that other professions and other businesses can't do. But if you're one of these clinicians and maybe you're feeling that squeeze, I meet you all the time. What I would ask you is don't get kind of pummeled down. Share your feelings with colleagues and find support. We all really like to help others, and sometimes that's just listening, giving you an ear, and then just supporting you. Part of what I hope this program does is just tries to show you that, hey, if you're feeling that financial squeeze, there's a lot of other clinicians feeling the same way. So don't feel down about that. We got to pick ourselves up. How do we pick ourselves up? We have to skill up. What does skill up mean? It's one of the things I've been talking about for the last couple of years, is that we have to learn to provide comprehensive dentistry so that we can ethically treatment plan for our patients and then spend the time to educate them on what's going on with their mouth. I think it's very important that we know how to provide comprehensive dentistry, and there might be some things in that comprehensive realm that you don't like to do, so maybe you don't do as much of that. But I think it's really important that we understand how to treatment plan comprehensively. The next thing I always tell, especially the young dentists, is to build your brand, and that brand should just be authentic to who you are. Don't try to brand yourself as the super dentist of aesthetics or something like that if you don't enjoy doing that, or if you're not able to do that well. But brand yourself for who you are. You're a compassionate person who likes to treat others and help them heal or get better or feel better about themselves. That's what patients really want to see, and they're going to probably see that today on social media. Then when you have this and you've kind of skilled up and you feel like you have a brand that's authentic to you, then think about that dream practice. A lot of the dentists that I meet are just working so hard, so many days, that they don't really sit down and figure out, okay, I like this practice, or I would like to have a different type of practice. So what I would encourage you to do is slow down, take some time, really think about the practice that you would like to have. If you don't take the time to do that, what happens is you work for 35 years and now the career is about to the end and you never really had a chance to be authentic to yourself. So if you can find the time and you can be brave enough to think about the practice that you would like to work in, then figure out how to make that a reality. Take little steps. It's not going to happen overnight. So you have to commit to this path that will take you to what it is that you envision. So your vision of your future practice. And remember, there are those that will push you to pursue your potential, and there's those that will just keep you stuck. And if you're around those that keep you stuck, find those that will help you pursue your potential. One of the things that we love about doing these live patient treatment programs is we actually are interacting with both the doctor, the patients, and the lab technicians to figure out what's the best way of treating these patients. And then we work with the doctors to provide that type of treatment. One of the best ways to learn. But I think the most powerful part of that is that when we're in a group and we're working together to provide this extraordinary treatment to our patients, we are helping each other push ourselves to pursue our potential. And I think that's the important part. Because a lot of times you go out and you're around colleagues and they're using the same materials they used when they graduated from dental school 30 or 40 years ago. They didn't want to change. They don't want to change. And you know what? They don't want you to change. So find a group of colleagues that will push you to help you pursue your potential. And then learn more, as I was mentioned before, and then use tools to see more. And I think then you'll do more. As you learn more, you see the potential for other treatments. And then you learn to provide that treatment. You're able to communicate better and more confidently with your patients, and you will do more. As you do more, you'll earn more. And if you manage that business of dentistry just right, you'll actually take more home. So learn and then earn. Because for me, when I showed you kind of what my last month looked like, why do I do that? It's not so I can teach others. It's when I go out and interact with others, they teach me. And there's always information that I take away from every group that I spend time with. And that keeps my mind going. And because I enjoy learning, to me, that makes dentistry exciting. So I may interact with other dentists, other hygienists, I may lab technicians, even dental students. And I just love that because from each one, I try to learn something. I don't have the attitude that I'm there to teach them something necessarily. I will share information with them, but I'm trying to figure out what I can get from them too. So my feeling is that dentistry is a great profession. We have so much control over how our business works, how we work within that business, that if you take it in, you take the time to develop that practice that matches your brand, that's authentic to you, that you're going to enjoy this profession. So I've been practicing now for 38 years, going on kind of the latter half of that 38. I'm looking forward to at least another 22. So if my body can hold up, my brain is looking forward to it, because this is one of the best professions to have. We go to work, we work on people we care about, friends and family, and we provide the best service that we can in a caring way, and we actually make a living doing that. So think about where you are, where you want to be. Keep up with these programs, because these programs will just bring ideas. And you may listen to a program for 10 to 20 minutes and think, I already knew that. Hey, that's good, because you know that what you're doing is right. Or you may watch it for 20 minutes and think, that's a great idea. I need to learn more about that. And if that's the case, then hit us with your comments, because we'll get back to you. Anyway, I know this is a little different. Just wanted to let you know that we're out here supporting you. Vista Apex Solutions, especially with all the different products that we have, all the services, we've got a lot of different products now. They're really designed to help you in your practice. And the team here, R&D team, all the way through the other parts of the company, we're just here to support you. So if you like this information, hit the like button. If you want to make sure you don't miss out on this information, hit subscribe. We've been doing this every week now for over a year, and it's really been a pleasure to bring this information to you. We're trying to build a community of like-minded individuals, colleagues that are really committed to provide the very best for their patients. So I congratulate you for being here, and leave a comment below. I'd be interested to hear your thoughts too. All right? Thank you very much.